Hello everyone, this is Medical Gateway, and today we're going to study regarding the immune tolerance. So what exactly is immune tolerance? Now, it is a state of unresponsiveness of the immune system to body's own antigens. It is a state of unresponsiveness of the immune system to body's own antigens. Now, what is the function of the immune system? Immune system is basically designed to get activated whenever there is a foreign antigen in our body. But this immune system does not respond to the body's own antigens. It just responds to the foreign antigens. It means that the immune system does not attack our own body antigens. Okay? Or basically, our body is tolerant to the immune system. Okay? So, how this immune tolerance is developed in the body? So, we have studied a concept of pre-processing while studying the humoral and the cell-mediated immunity. So, what was happening in the pre-processing? In the pre-processing, it was happening that before birth, self-antigens are exposed to the lymphocytes. And if any lymphocyte reacts with the self-antigen, that lymphocyte is destroyed. So when the lymphocytes are growing, these lymphocytes are exposed to the self-antigens, the body antigens. And if that lymphocyte attacks the self-antigen, that lymphocyte is destroyed. Okay? So that's how, during the pre-processing of the lymphocytes, immune tolerance is developed in the body. So our body does not produce or does not mature those lymphocytes which have the ability to accidentally attack our own body cells. So this is a normal phenomenon. Now, what happens in autoimmune diseases? Now, this is a pathological condition. This is a disease where something has gone wrong. So what has gone wrong in the autoimmune diseases? In autoimmune diseases, basically the immune tolerance is lost. Our body's own immunity attacks our own body's antigens. Our own body's lymphocytes basically react or attack the self-antigens. So this is the autoimmune disease. Our immunity, our own defense mechanism, is turned against our own antigens. Our own body lymphocytes starts attacking our own body antigens. Now, this is a crazy disease. Okay? Now, there are many examples given in the Guyton, which are rheumatic fever, glomerulonephritis, systemic lupus erythematosus, and myasthenia gravis. Now, in rheumatic fever, immune system attacks the heart. In glomerulonephritis, the immune system attacks the kidneys. In systemic lupus erythematosus, commonly known as SLE, immune system attacks many organs of the body, including the skin, the joints, the heart, the lungs, the blood cells, and many more. In myasthenia gravis, the immune system attacks the neuromuscular junction. Okay? So this is autoimmune diseases. Autoimmune diseases are more common in females as compared to the males. Okay? Now, to treat the autoimmune diseases, we basically give immunosuppressants, and when we give immunosuppressant, then the body is more prone to the infections. Okay? So this is immunotolerance, and then autoimmune diseases in which the immunotolerance is lost. So this is it. See you in next part.